Welcome to this deep dive, and this one is specifically for you. We're going to be tackling a topic that you requested, and that is NSTEMI.
Right.
As an emergency physician, this is a really tricky diagnosis to make, especially because it doesn't always present like that really dramatic Hollywood heart attack.
Yeah.
We're going to be unpacking the 2023 European Society of Cardiology guidelines for managing acute coronary syndromes to help you confidently diagnose and manage these cases.
Sounds good.
Now, of course, remember, these guidelines are a fantastic resource, but they shouldn't replace your individual judgment for each patient.
Yeah, it's important to emphasize that point. Every patient is unique, and these guidelines should be used as a tool to guide your decision-making, not as a rigid set of rules.
Right. So before we dive into all the nuances, let's just start with the basics. What exactly is an NSTEMI, and how does it differ from a STEMI?
So NSTEMI stands for Non-ST-Elevation Myocardial Infarction. It's a type of heart attack where, unlike a STEMI, the EKG doesn't show that classic ST segment elevation. Think of it like this. A STEMI shouts, "Heart attack!" loud and clear on the EKG, while an NSTEMI whispers.
Oh, it's a great analogy. I like that. So if the EKG isn't screaming heart attack, how do we recognize an NSTEMI in the emergency department? What symptoms should we be looking out for?
So chest pain is a common symptom, but here's where it gets tricky. Some patients, especially older adults and women, may present with atypical symptoms that might not immediately make you think of a heart attack.
Atypical symptom, like what?
Exactly. So we're talking about things like shortness of breath, nausea, or just feeling unusually fatigued. These symptoms might be easily attributed to something else, especially if the patient doesn't have that classic crushing chest pain.
So we can't just rely on a patient's, self-reported symptoms, and we've established that the EKG might not give us a definitive answer either. What are our other tools for diagnosing NSTEMI? What do the guidelines say about that?
So high-sensitivity cardiac troponin tests, or HSCTN, are absolutely essential. These tests are incredibly sensitive and can pick up even tiny increases in troponin, which is a protein released into the bloodstream when heart muscle is damaged.
So we're looking for those subtle signs of heart muscle damage, even if the EKG isn't giving us the full picture. But the guidelines mention specific algorithms for using these tests right.
Yeah, they recommend either a 0-hour, 1-hour algorithm or a 0-hour, 2-hour algorithm.
Okay.
Essentially, you're taking an initial troponin level and then repeating it either after 1 hour or 2 hours, depending on which algorithm you're using. These algorithms help you interpret the changes in troponin levels over time, which can be very helpful in making the diagnosis.
That makes sense. It's not just about a single troponin level, but about how it's trending over time. But I imagine there are other factors that can complicate the interpretation of these test results, right?
Absolutely. Age, kidney function, and the time from symptom onset can all affect troponin levels. It's not a simple yes or no answer.
So it sounds like diagnosing NSTEMI requires a bit of detective work, taking into account the patient's history symptoms, EKG findings, and troponin trends. And to make things even more complex, elevated troponins don't always mean a heart attack, right?
You're absolutely right. Other conditions, such as myocarditis sepsis or even heart failure, can cause troponin levels to rise. It's crucial to consider the bigger picture and not jump to conclusions based on a single test result.
This really underscores the importance of clinical judgment in emergency medicine. You need to be able to synthesize all the information and make a decision even when the situation is ambiguous.
Precisely.
Yeah.
It's about connecting the dots, considering all the possibilities, and using your expertise to guide your decision-making.
Okay, so let's say we suspect an NSTEMI based on the patient's presentation and our initial workup. What's next? How do we manage these patients in the emergency department? The guidelines talk about urgent action being key.
You're right. Prompt treatment is essential in NSTEMI.
Okay.
First and foremost, if a patient has low oxygen levels, oxygen therapy should be initiated immediately.
That's a fundamental step. What about medications? What do the guidelines recommend in terms of pharmacotherapy in the ED?
So nitrates can be given to help relieve chest pain, but it's important to note that they shouldn't be used for diagnosis.
Okay.
While a reduction in chest pain after nitrates might seem like a good sign, it doesn't necessarily rule out other conditions.
That's interesting. So nitrates for symptom relief, but not for confirmation of a heart attack.
Yeah.
What other medications should we be considering in the early stages of NSTEMI management?
So aspirin is a cornerstone of treatment and should be given as soon as possible. Other antiplatelet medications like clopidogrel are also recommended to prevent further clot formation. Think of them as tiny traffic cops, preventing platelets from sticking together and forming a larger blockage in the coronary artery.
I like that analogy. So aspirin and clopidogrel are like traffic cops for platelets. What about anticoagulants? Do they have a role to play in the emergency department management of NSTEMI?
Yes, anticoagulants such as heparin or enoxaparin are recommended to reduce the risk of clot formation.
So we're talking about a multi-pronged approach. Oxygen therapy nitrates for symptom relief, antiplatelet medications to prevent further clotting, and anticoagulants to keep those blood vessels open. Anything else we should be considering in the ED for these patients?
For high-risk patients, the guidelines recommend early invasive angiography and percutaneous coronary intervention, or PCI.
Can you explain what PCI is for those who might not be familiar?
So PCI is a procedure where a tiny balloon is inserted into the blocked coronary artery and inflated to open it up. This helps restore blood flow to the heart muscle, minimizing damage.
So sometimes opening up that blocked artery with PCI is the most effective way to limit the damage caused by an NSTEMI.
Exactly. It's all about restoring blood flow as quickly as possible to protect the heart muscle.
We've covered a lot of ground already. We've defined an STEMI, talked about those tricky presentations, discussed the importance of troponin testing and how to interpret those results, and outlined the crucial steps for managing these patients in the emergency department.
And we're just getting started. There's so much more to discuss about the long-term management of NSTEMI and some special considerations for certain patient populations.
Stay tuned, because in the next part of this deep dive, we'll go beyond the ED and explore those long-term strategies for NSTEMI management. Okay, so we've stabilized our patient in the ED, and they're doing better. Now let's think about the bigger picture. What happens after they leave the emergency department? What does long-term management for an NSTEMI patient look like?
That's a great question, and it's an essential part of the conversation. Long-term management of NSTEMI is all about preventing future cardiac events and helping the patient regain their quality of life.
So it's not just about fixing the immediate problem, but about empowering them to live a healthier life moving forward. What are some of the key strategies for achieving that goal?
So the guidelines highlight a multifaceted approach that includes lifestyle modifications, medications, and cardiac rehabilitation. All three components work together to reduce risk and improve outcomes.
Let's break that down a bit. First, let's talk about lifestyle changes. What specific modifications do the guidelines recommend for NSTEMI patients?
The big ones are quitting smoking, adopting a heart-healthy diet, limiting alcohol intake, and getting regular physical activity. These changes might sound simple, but they can significantly reduce the risk of another heart attack.
They're simple in theory, but we all know how hard it can be to make lasting lifestyle changes. That's where patient education and support come into play, right?
Absolutely. It's crucial to provide patients with clear and concise information about their condition and why these changes are so important. We need to equip them with the knowledge and tools they need to succeed.
So it's not just about telling them what to do, but about explaining the why behind it and empowering them to take ownership of their health. Now let's move on to medications. We talked about some medications used in the emergency department. What about long-term medications for NSTEMI patients?
Several medications are often prescribed long-term to reduce the risk of future cardiac events. You already mentioned aspirin and clopidogrel, which are antiplatelet medications. Those are often continued for an extended period after an NSTEMA.
So those traffic cops we talked about earlier stay on duty to prevent those platelets from causing any trouble down the line. What other medications are typically part of a long-term management plan?
Beta blockers are another important class of drugs. They help slow the heart rate and lower blood pressure, reducing the workload on the heart.
Makes sense. Give the heart a bit of a break. What about cholesterol? Do the guidelines address that?
Absolutely. Statins are essential for lowering cholesterol levels, which can help prevent the buildup of plaque in the arteries.
So we're talking about antiplatelet medications, beta blockers, and statins. Are there any other medications that might be prescribed for NSTEMI patients?
Yes, for patients with certain conditions like heart failure, ACE inhibitors, or ARBs might be prescribed as well.
It sounds like a personalized approach with the medication regimen tailored to each patient's specific needs and risk factors.
That's exactly right. It's not a one-size-fits-all approach. The treatment plan should be individualized based on the patient's overall health, their risk factors, and their response to therapy.
Okay, so we covered lifestyle changes and medications.
Yeah.
What about cardiac rehabilitation? What role does it play in the long-term management of NSTEMI?
Cardiac rehabilitation is a comprehensive program that helps patients recover after a heart attack and make positive lifestyle changes.
Okay.
It usually involves exercise training education about heart health and counseling to help patients manage stress and other risk factors.
So it's a holistic approach addressing both the physical and emotional aspects of recovery.
Precisely. Cardiac rehabilitation empowers patients to take control of their health and reduce their risk of future heart problems. It provides them with the tools and support they need to make lasting lifestyle changes.
This brings up an important point that the guidelines emphasize patient-centered care. What does that look like in the context of NSTEMI management?
Patient-centered care means involving the patient in all aspects of their care. It's about listening to their concerns, understanding their preferences, and working together to make decisions that align with their values and goals.
So it's a collaborative approach where the patient is an active participant in their healthcare journey.
Exactly. Shared decision-making is key. We provide the information and guidance, but ultimately the patient has the final say in their treatment plan.
And this collaborative approach extends to patient education as well, right?
Yeah.
What did the guidelines recommend for effective patient education strategies?
The guidelines recommend using clear and concise language, avoiding medical jargon as much as possible. It's about making sure patients truly understand their condition, their treatment plan, and why it's so important to stick with their medications and lifestyle changes.
That makes sense. It's not about impressing them with our medical knowledge, but about empowering them to make informed decisions about their health.
One specific technique the guidelines highlight is the teach-back method. This involves asking patients to explain in their own words what they've learned about their condition and treatment. It's a simple but powerful way to ensure understanding and identify any areas where further clarification is needed.
So it's a way to close the loop, making sure the message has been received and understood, not just delivered. Now we've been focusing on the general principles of NSTEMI management. But these guidelines also address some unique situations and patient populations.
You're right. The guidelines delve into the management of NSTEMI in patients who have other medical conditions. For example, they discuss the approach to patients with NSTEMI who also have cancer or those who have recently had COVID-19.
These situations add another layer of complexity to NSTEMI management. What are some of the key considerations in these cases?
The main challenge is balancing the risks and benefits of various treatment options. For example, some medications used to treat NSTEMI might increase the risk of bleeding, which could be particularly problematic for a patient with cancer or who is recovering from COVID-19.
So it's about carefully weighing the potential benefits against the potential risks and making decisions that are tailored to the individual patient's circumstances.
Exactly. It highlights the importance of a personalized approach and the need for clear communication between the healthcare team and the patient.
And are there any other special patient populations that the guidelines address?
Yes. The guidelines specifically discuss the management of NSTEMI in older adults.
What are some of the key considerations for managing STEMI in this population?
Older adults might be more likely to have other medical conditions and be taking multiple medications, which can increase the risk of interactions and side effects. They might also have different physical abilities, which could impact their ability to participate in cardiac rehabilitation. It's crucial to tailor the approach to their individual needs and circumstances.
So again, it comes back to that individualized, patient-centered approach that we've been talking about. Now, before we wrap up this part of the discussion, I want to revisit a topic we touched on earlier, MINOSCA. Remember, this is where a patient has heart attack symptoms and elevated troponin levels, but their coronary arteries appear normal on angiography. It's a bit of a head-scratcher, right?
You're right. MINOSCA can be quite puzzling. It's like a heart attack without the obvious culprit.
Exactly. And the guidelines specifically address this tricky diagnosis. What do they recommend for evaluating and managing these patients?
The guidelines emphasize the importance of a thorough investigation to uncover the underlying cause. This might involve various tests, including advanced imaging techniques like cardiac MRI, to look for subtle abnormalities that might have been missed on initial angiography.
So we're putting on our detective hats and digging a little deeper to find the root of the problem. What are some potential causes of MINOSA that we should be thinking about?
There are several possibilities. Coronary artery spasm, where the arteries temporarily constrict, can mimic the symptoms of a heart attack. Another possibility is spontaneous coronary artery dissection, or SAD, where a tear occurs in the wall of a coronary artery. Microvascular dysfunction, where the tiny blood vessels in the heart are not functioning properly, can also lead to MINOCA.
So even though the EKG might not scream heart attack and the major arteries might look clear, it's essential to keep an open mind and consider all possibilities.
Absolutely. Trust your clinical judgment. If something doesn't add up, don't be afraid to dig deeper. The patient's history, their symptoms, and those subtle clues can often point you in the right direction.
And that's what makes emergency medicine so challenging and so rewarding. We're constantly solving puzzles and advocating for our patients.
Well said. It's about connecting the dots, putting the pieces together, and using our knowledge and expertise to provide the best possible care.
We've covered a lot of ground in this part of our deep dive. We've explored those crucial long-term strategies for managing NSTEMI, including lifestyle modifications, medications, and cardiac rehabilitation. We've also highlighted the importance of patient-centered care, clear communication, and a personalized approach.
And we've delved into some of the unique challenges of managing NSTEMI in patients with other medical conditions and in older adults. Plus, we revisited that head-scratching diagnosis of Manuka.
But there's one more crucial aspect we need to discuss, the importance of research and ongoing learning in this field. So stay tuned for the final part of this deep dive, where we'll explore the exciting world of NSTEMI research and what the future holds for managing this complex condition. Welcome back to the final part of our deep dive into NSTEMI. We've explored the initial diagnosis, the urgent treatment in the emergency department, and the long-term management strategies.
And now we're going to shift gears a bit and talk about the exciting world of research in NSTEMI.
You know, when I think about research, the first word that comes to mind isn't always exciting, but I'm willing to be convinced. Tell me more about why research is so crucial in this field.
Well, what's fascinating about these guidelines is that while they provide a really comprehensive framework for managing NSTEMA, they also highlight areas where we still have unanswered questions, areas where more research is needed to optimize patient care. It's like we have a roadmap, but some of the roads are still under construction.
So it's not a finished book, but a story that's still being written. That makes sense. Can you give me some specific examples of areas where research is still needed?
Sure. One area that comes to mind is the optimal duration of dual antiplatelet therapy after NSTEMA. We know that taking 2 antiplatelet medications is beneficial in the short term, but how long should patients continue this therapy? What's the best balance between preventing clotting and minimizing the risk of bleeding? These are questions that ongoing research is trying to answer.
So the guidelines give us a starting point, but research helps us fine-tune our approach and personalize treatment even further.
Exactly. And another area where research is making a real impact is in personalized medicine. We're talking about using genetic testing or other biomarkers to predict which patients will respond best to certain treatments. Imagine being able to tailor therapies to an individual's unique genetic makeup. That's the future of medicine.
That sounds incredible. It's like moving away from that one-size-fits-all approach and towards more targeted and individualized treatment strategy. What other exciting advancements are on the horizon in NSTEMI research?
Well, researchers are constantly exploring new medications, new procedures, and new ways of thinking about NSTEMI. For example, there's growing interest in using stem cell therapy to repair damaged heart muscle after a heart attack. There's also ongoing research into developing more sensitive and specific biomarkers for diagnosing and monitoring NSTEMI.
All this sounds incredibly promising. But how does all this research translate into real-world improvements for our patients? It's great to have all these exciting developments happening in the lab, but how do we make sure those benefits reach the people who need them most?
That's the key question, and that's where the connection between research and clinical practice is so vital. The findings from clinical trials and other studies directly inform the development of new guidelines and treatment protocols. Research shapes the way we practice medicine, and ultimately it's the patients who benefit.
So it's a continuous feedback loop. Research informs practice, and practice identifies areas for further research. And through this cycle of learning and improvement, we're constantly raising the bar for patient care.
Exactly. And that's why it's so important for clinicians to stay up to date on the latest research findings, read those journal articles, attend those conferences, and engage in those discussions. It's all about providing the best possible care for our patients, and that's what drives us to keep learning and pushing the boundaries.
And that brings us to the end of our deep dive into NSTEMA. We've covered so much ground, from defining this often subtle heart attack to understanding its diagnosis, treatment, and long-term management.
We explored those tricky presentations that can catch us off guard, the importance of those high-sensitivity troponin tests, the crucial role of prompt and decisive treatment, and the need for a personalized and patient-centered approach.
We also discussed those special considerations for managing NSTEMI in patients with other medical conditions and in older adults, and we delved into the mysteries of Manuka.
And finally, we talked about the exciting world of NSTEMI research and how it's shaping the future of care for our patients. It's a reminder that we're all lifelong learners in this field, and that commitment to ongoing learning is what makes our profession so rewarding.
Absolutely. Remember, even though the EKG might not always scream heart attack, Trust your clinical judgment. Keep NSTEMI on your radar, especially in those patients with that nagging feeling that something just isn't right. Don't hesitate to dig a little deeper, ask those tough questions, and consider all the possibilities. And never stop learning. The world of medicine is constantly evolving, and we need to keep pace to provide the best possible care for our patients.
Well said. Thanks for joining us on this deep dive into the world of NSTEMI. Until next time, stay curious and keep those minds sharp.